Hey everybody, Dr. Ron Eaker here, and I'd like to take just a few minutes, I promise just a few minutes, to tell you about something that is revolutionary and has changed some lives for people suffering with certain issues associated with perimenopause and menopause. And I'm talking about vaginal dryness, discomfort, pain with intercourse, burning. It's an issue that's incredibly common. I am asked about it on a daily basis. And it's very frustrating because up until now, we've been relatively limited in what we can do for individuals who are bothered by this problem. And it's a significant problem. It's not something to be taken lightly. I mean, let's face it, 60 is the new 40. And there's no reason that someone, as they get into their mature years, where I'm at, of course, has to give up intimacy because of a physical issue like vaginal atrophy or thinning of the vaginal tissues. As I said, it's an incredibly common problem, and it's something that can be addressed. And the biggest problem that we have as OBGYNs is making people aware of the different options that are out there. Well, today I want to tell you about a relatively new option that is changing lives. It's making such an impact on people, and I'm talking about the Monalisa Touch Laser. It's a very simple in-office procedure. It takes literally 5 minutes and it's pain-free. There's no downtime. You can literally have it done and go back out to your activities. But it's changed the treatment modalities available to women. Quite honestly, up until now, basically there were two treatments available for the vaginal dryness. One was over-the-counter lubricants and products like KY, and those were just Band-Aids. They treated the problem, but really didn't solve anything other than provide a temporary relief. The second are hormone treatments, and those are either taking hormones systemically by mouth or by a gel, or using topical vaginal estrogen creams or vaginal inserts. There's a new product on the market that is being advertised as non-hormonal, but actually the contents of the medicine is converted to hormones in the system, so I still lump that into the category of hormonal. And they work. Those work, and they work well. And we'll talk a little bit about the pros and the cons of those. But that used to be all that was available. Well, now we have the Monalisa Touch Laser. And we're the first in the Augusta area to offer that. And it's a revolutionary tool for treating dryness, pain, discomfort with intercourse. And it's very different from the standpoint of A, it has no hormones, obviously. B, it's a simple process. It's done in the office. It takes 5 minutes. There's no pain involved. And you can literally go out and go to lunch or to the gym or back to work. And we do a series of 3 treatments over divided by six weeks. And for 90% of folks, that's all that's involved. Now, 10% of people need a periodic booster. But that's in contradistinction to the hormones. When you use the hormones, they have to be used pretty much on an ongoing basis, or you'll quickly slip back into the same process, the same problem that got you to that place. See, what happens is the tissues get thin in the menopause. They're hormone-sensitive tissues. And they, whether it's a natural menopause or a surgical menopause, those tissues will thin out. And that's what creates the decreased lubrication, the decreased elasticity. The Monalisa laser actually stimulates the fibroblasts, which are the cells right under the lining of the mucosal cells, and they produce elastin and collagen and the substances that are kind of lost during that time frame. And that increases the elasticity of the vaginal tissue, it increases the moisture, and it really changes how a patient feels with regards to those particular symptoms. It's all about treating those symptoms. What I want to do real quickly is just show you a very brief video that outlines exactly what happens with the laser, because a lot of people have questions. They come in and say, well, the laser in the vaginal tissue, that doesn't sound that great. But promise, I've been doing this now for over a year, probably done over 100 patients, and it really is very, very comfortable, but more importantly, very successful. I can't tell you the number of patients that I've had come back in and say, this has changed my life. This has changed my life and my husband's life. It's revolutionized our ability to be intimate. And for a lot of people, that's not only a physical problem, that's an emotional issue. So it really spreads its tentacles throughout a relationship. So it's very important. It's something we don't take for granted. It's something that you don't just have to live with. So take a moment and watch this video, and then I promise you, if you'll stay to the end, I'm going to make it worth your while, because I want to offer you a special discount on the Monalisa as we kind of launch this again, and just repay you for taking the time to look at this video. So just stay till the end and I'll tell you about this special offer. But now let's watch a brief video on the Monalisa laser.
Become yourself again with Monalisa Touch. It's okay to talk about it. Gynecologic health is an important aspect of a woman's overall well-being. When estrogen levels decline due to menopause, women experience changes in their gynecologic health. And studies show that only 25% of women seek help from their doctor. Now with Monalisa Touch, there is a treatment to address these changes. This procedure has been described by patients as life-changing, and they want to talk about it. A large portion of postmenopausal women and women treated for breast cancer or induced menopause are experiencing changes in their gynecologic health. The Monalisa Touch offers a non-surgical approach to deliver lasting relief that is typically noticed after the first treatment. Monalisa Touch offers women a new therapy that has minimal side effects, no downtime, and lasting results. It's time to talk about it, because now you can do something about it. Patients typically describe Monalisa Touch in 2 words: simple and safe. How does Monalisa Touch achieve these results? Similar to your yearly exam, a probe is inserted into the vaginal canal, a gentle laser is fired, and a pattern of microablative wounds target the vaginal tissue. The injury triggers a wound healing process that causes revascularization and increases in collagen in the vaginal mucosa. The therapy requires 3 treatments, each lasting less than 5 minutes. Because no anesthesia is required, and it is done in your doctor's office. The best part? No downtime and virtually no pain or side effects. When women are experiencing changes in their gynecologic health, being treated with the Monalisa Touch may positively impact their overall health and also their quality of life. Monalisa Touch has been successfully treating women since 2012 and delivering results that have been overwhelmingly positive and immediate. The Monalisa Touch difference allows you to feel better with no downtime and minimal discomfort, which is important to you and your doctor. With Monalisa Touch, it's not only okay to talk about it, it's okay for you to talk about it too. Talk to your doctor today about Monalisa Touch and become yourself again.
Well, I know it works because I see it every day. I've seen the testimonials, the patients who have come back and said, wow, this was fantastic. I tell you who it really has been so satisfying to treat are patients who were very young and went through a surgical menopause or had breast cancer and really had a very, very difficult time because they couldn't take hormones or didn't want to take hormones and were having terrible issues with pain and discomfort. And then after treatment with the Monalisa, their ability to be intimate without pain and discomfort was vastly improved, and it's just amazing to see the difference in their lives and the lives of just regular menopausal folks who have gone through those changes. Another group of people that have been very successfully treated with this is a problem called lichen sclerosus. It's not that common, But when it occurs, it's devastating because it decreases the elasticity, just like the menopause. So it works really well with these individuals also. And there's accumulating evidence that we may be able to even improve some bladder issues with urine loss with this. It's not really targeted towards those individuals right now. I kind of consider that a nice side effect, but I think in the future we're going to see that this may be a treatment for those individuals also. So again, the biggest advantages of the Monalisa is it's in office, it takes 5 minutes, it's pain-free, it's effective. That's the most important thing. What's the big disadvantage? Well, it's not covered by insurance. And of course, nothing worthwhile is these days, right? So it is an out-of-pocket expense. Currently, it's $1,800 for the series of 3 treatments. Now, of course, we have payment plans. You can break that into 3 payments over time. We utilize Care Credit, which many of you are familiar with, which allow you to pay that over a period of time. Well, I'll tell you, because you've taken the time to listen and watch this video, and because obviously you're interested because you probably are having some of these issues, and we really want to make this available to as many people as possible, if you will click the button below, it'll take you to a coupon page where you can get a code for $300 off the procedure. All you have to do is when you call the office and you decide you want to do the procedure, you just give them that coupon code, and immediately the cost for the procedure is $1,500. And let me add this, that's $1,500 essentially for life, because if you're one of those 10% who still have to have a booster periodically, we'll never charge you again for the laser. It'll just be an office visit. So I think we really wanted to make this as available to as many people as needed, because it is such a valuable tool for really solving a major problem. So if you're interested, here's what you do. If you need some further information and want to discuss something more specifically related to your situation, call the office, 706-733-4427, and speak with Debbie and set up a free consultation. That's not a problem. There's very few people who can't have this procedure due to medical reasons, etc. But if there's a question about it, feel free to call. We'll set up a consultation. The next thing you can do is just click the button below and be able to get that coupon and go ahead and schedule, because this is only going to run for a certain period of time. We're only going to be able to extend this for a couple of weeks. So be sure you act now so we can go ahead and get you a spot and you can get that discount. And then if you just have any other additional questions or concerns you just want to ask, feel free to send me an email at reaker@yahoo.com. Remember, this is a common problem. It's treatable. There are options. The biggest problem is doing nothing, because it's not going to get better by itself. If there's a way we can help you, let us know. Thanks for taking the time to watch this. Make healthy choices.